Okay, I'll tell you why. So long because this is for the company. He will buy more. But I will show you. So this is a size around 25 to 30 centimeters. You just take it, cut it, and then you need that. Why? Because you should use this way and this way. Now this is ready for use.
No, this is not Lucia.
This is Lucia. Happy now? Happy? Okay.
Wait,
Happy.
Come back.
No, this is Lucia. This is it. Okay, so this is the way, and why you need more, because you need control, yeah. So this 1 or 2 or maybe 3, and then 1 or 2, and 3. Then you have around 2 centimeters in the between, and these two hands, these two fingers are helping to control. That's why you see, like this one is just to hold it. This is just to hold it, and these two is to guide it. Like if I want to use, for example, you see, like this one is guiding. This one is only holding. So for example, you want to brush, like to clean, it will go inside. You just go inside once and you come out. Like this and like this. To go inside, clean this side first, and then you go inside, clean this side second time. So this is the way you use it. But for me, because I know how to use it, I just use around this size.
What?
Then if you can hold it, because I just hold it in this way.
Yeah, I just hold it.
If you can hold it and you can manage it, then it is enough. Like this size, for example. If you can control it, it's enough. If you can control. But if you cannot control, the best way to take a longer one and then grasp it around your finger and then use it. So this is the, I think, no, this will clean. And you know, many times the dental cloth that you buy, the floss itself inside there is fluoride and mint. So when you go inside, then they will clean, and also they will brush and they'll disinfect. So this is like, it is like toothbrush with toothpaste, because there are lots of things inside. It's not only a thread.
Yeah.
They put minerals, they put fluoride, they put lots of things inside. Okay, so this is also very important, and it is more important than toothbrush. So you now end the session, you can ask.
There's two types of floss, right?
There are many.
I mean, what I saw first, just two kind. Like one is like a flattened one, and one is like straight. Just really thin. So
you see, like there are many types. But for me, like you have, like, see, like this only single thread. Some of them are like, you see, it's double or triple. It's like this. Some you see it is plastic. Some you see it is thick. Some it is thin. So it's up to you completely which one you like. Because you know, sometimes some people their tooth is very tight, very tight. So if they use the big one, it cannot go in. So you just go to the market and buy the thin one. Then it can. For me, like I use the very thin one. But the very thin one, if you use it and if you go slowly and you drop down, sometimes you may traumatize the gum. Then you are bleeding because it is very thin. So not to be very thin, not to be very thick. Just check whether it can pass through your tooth or not. Then you can use it.
Can we use the floss for the tongue?
There are a special type of brush for the tongue, but the best way is to use the toothbrush, because you know this one, you see, it can go inside. The tongue is like the tongue surface. You see it is smooth, but actually it's not smooth. So it is like this. When you clean with this one, it can go inside. Floss cannot go inside. Cannot clean it, because the tongue that you see like it is like this, but it's not actually like this. If you see it under microscope, it is like this.
Oh yeah, it's because of the tongue buds.
So this is the tongue. So this one cannot go inside. You need this. More option? More?
Nothing.
Also, very important is like the children also, if they go at early age to the dentist, then he can decide whether they need some ortho. You know orthodontics? People put some brackets. So they can go and they can solve this problem much early and much cheaper. Until you wait to the age of 18, and then it will be more expensive. Because in the children, maybe they can treat it within 6 months to 8 months, very low price. But if you go late, then they cannot align the tooth. Treatment takes around 3 years, and it costs a lot. I don't know in Hong Kong, but I think it should be more than 200,000 Hong Kong dollars. Yes, very expensive because it takes 3 years.
How
3 years.
much
Should we wait till all the permanent teeth come out, or?
No,
Yeah.
because many of the malalignment they start to develop when there is baby and permanent tooth together. So it is good, like at the age of 6. Starting from the age of 6, when the children have baby and permanent, every year at least once, If you are very sure about the tooth that of yourself and shit and nothing wrong, very sure, okay, every 2 years. But usually no, every year at least once, go to the dentist, they can check up. Because if they can't, because many people, they go to the dentist, they say, oh, 1 year, one time, why I pay $100 or $500 for doctor or dentist? But he don't know, like if you go at that time, then you spend $500, for example, for visiting, and there is a small problem here, like this, for example, and the doctor can fill it for you for only 1,000 Hong Kong dollar. But if you stay, you go after you have problem or pain, then the doctor will see, from outside is like this, but from inside is something like this. You cannot see. The doctor will say, oh, it should be clean outside, and when we should do RCT, then they will charge you 10,000. So which one of them is better? 1,000. Let's go and check it. So it's better to go and check the dentist every 1 year, one time, unless you are very sure. Like for me, I don't go to dentist because I'm sure, alhamdulillah. I know how to clean, and for my relatives. Yes. So this is all. If you have more questions, inshallah, we'll be happy to answer.
I don't have any.
Hey.
The problem is the last piece.
Thank you.
Yeah.
You cannot use the
This is for
you
kids.
cannot use
Okay, doctor?
the last tooth.
How you will use it? Yeah, it's not easy. It's not easy. But I will use it.
You need help for someone.